Welcome to our first video in showcasing some sample questions in preparation for the Philippine Respiratory Therapy Licensure exam. By the end of this session, you will be able to critically evaluate and answer sample board examination questions by applying core respiratory therapy concepts, recognizing common test formats, and utilizing effective strategies to improve exam readiness. Important notes. You'll be given 1 minute per question to answer. Be honest, finalize, and lock in your answer before the timer ends. And lastly, correct answers and rationale will be discussed on the later part of the video. Ready? Congratulations, you've made it. So, how was it? Was it challenging? I bet it wasn't for you. Now, let's move on to the answer and rationale part of this video. So, ready your pen and paper and see how many questions you've answered correctly. Question number 1. A 50-year-old patient has been admitted to the surgical ICU for treatment of a large hemothorax in the right thorax. In reviewing the chest radiograph obtained before the procedure, the therapist would expect to see the characteristic. And the correct answer is letter B, blunting of the right constrophrenic angle. Since A can only be seen to patients with pneumonia, while C and D are seen to patients with heart conditions, which isn't the case of this patient. Question number 2. Which of the following laboratory test is consistent with overhydration? And the correct answer is letter B, urine specific gravity, with 0.996%. It could suggest or indicate that the urine is too dilute, possibly due to drinking too much fluid or conditions like diabetes, insipidus, or kidney disease. To be considered as overhydration for CVP, it should be higher than the normal range of 1 to 7. But since A is within normal limits, it is not considered. As well as PCWP, it is also within normal range, and it should be higher to be considered as overhydration. For letter D, Ellis ratio is a test for fetal lung maturity. So, it is not the correct answer. Question 3. A 40-year-old female has an admitting diagnosis of left upper lobe pneumonia. She is producing small amount of sputum. Based on this information, her chest radiograph should reveal. And the correct answer is letter B, infiltrates. Infiltrates are common radiographic findings in pneumonia. Blunting of claustrophrenic angles can only be seen if there is fluid in the pleural cavity, while whiteout of both lungs is common finding in respiratory distress syndrome, while letter D, depressed hemi-diaphragms, is a finding in conditions with overdistension of lungs. Question 4. A 44-year-old patient has been admitted to the medical floor for shortness of breath and hemoptysis. In order to detect any abnormalities or lesions in the thorax, the physician is likely to order. And the correct answer is A, MRI study of the thorax. MRI is the most helpful for the detection of abnormalities or lesions in the thorax. Induced sputum sample is helpful to detect presence of abnormal cell types, but it does not contribute to the detection of any abnormalities or lesions in the thorax. Chest radiograph is not as specific or sensitive as MRI, while pre and post bronchodilator studies are done to evaluate the reversibility of bronchospasm by bronchodilators. Question 5. A patient is being mechanically ventilated on an SIMV mode and no assist or spontaneous breaths are recorded. The inspiratory time is 0.6 seconds and expiratory time is 1.8 seconds. What is the calculated eye-ear ratio? The correct answer is letter B, 1:3. How? To find the eye-ear ratio given the eye time and E time, divide both sides of the ratio by the inspiratory time, which is 0.6. So if you're going to divide 0.6 by itself, it is equal to 1. And if you're going to divide 1.8 by 0.6, it is 3. So the correct answer is 1:3. Question 6. A 45-year-old patient is being mechanically ventilated on a volume-controlled mode. He has no spontaneous efforts. The observed IE ratio is 1:1.5. In order to change the IE ratio to 1:2, the RT should, and the correct answer is letter A, increase the inspiratory peak flow. Why? IE ratio of 1:2 is achievable by increasing the inspiratory peak flow. This maneuver would shorten the inspiratory time and prolong the expiratory time. Changing of PEEP cannot affect the IE ratio. So we could disregard B and D. For C, decrease the expiratory time. Decreasing expiratory time is not a ventilator control. Furthermore, decreasing the expiratory time would lower the IE ratio. From this example, from 1 is to 1.5 to 1 is to 1.2. Question 7. The QRS of V1 lead on a standard ECG printout is normally blank, the baseline, because the cardiac electrical conduction is moving blank, the location of the V1 lead placement. The correct answer is letter D, below and away from. Since V1 lead is placed on the right side of the sternum and the normal cardiac electrical flow from sinus node ventricles moves away from this lead, the QRS is below the baseline. Question 8. The electrode for lead V2 of a 12-lead electrograph is placed on the fourth intercostal space at the left sternal border. Question 9. Lateral neck or upper airway radiograph is indicated for all of the following conditions, except letter D, post endotracheal intubation. Anterior posterior upper airway radiograph is indicated following endotracheal intubation. Question 10. The patient has the following electrolyte measurements for sodium, potassium, chloride, and bicarbonate. These values indicate that he may have a condition called letter B, hypernatremia. Why? Because sodium is higher than the normal range, while A, or the chloride of this patient, is within normal range, so it is not considered hyper. While C, hypokalemia, the potassium on this patient is also within normal range, so we could also eliminate that. While D, though bicarbonate is lower than normal range, acidosis is indicated by pH and not bicarbonate. Yay, that's all for today. If you like this kind of video, hit like and subscribe to my channel for more videos. Bye.